Okay, welcome everybody. Thanks for making it today, despite the celebrations. We've got a newcomer joining. Happy Easter to everyone celebrating. Ramadan Mubarak for everybody celebrating. Today, I'm very excited to be introducing our guest, who is Dr. Vanessa, and who is going to be sharing with us about dental health, something that many of us have a phobia about, even some of the smartest of us. Despite knowing about dental health, it can be a real phobia. So hopefully we can debunk some of those fears and really learn some preventative measures so that we don't have to go to the dentist. Okay, so Dr. Vanessa Moussa has over 6 years of experience in general dentistry, and she trained in Romania. She furthered her education in aesthetic dentistry in France. In her dental career, Dr. Moussa always believed in treating the patient as a whole. She believes it is her professional duty to educate every patient about the importance of oral health and its impact on general health by establishing healthy habits and diet to have a cavity-free and healthy smile. Her motto is, "Without a healthy mouth, we can't be healthy." She also believes a healthy smile affects our mental health and vice versa. Being empathetic, focused, patient, and passionate about mental health, she has been dubbed the gentle dentist. Unsurprisingly, she has decided to take on her passion for psychology and mental health and has switched her career from oral health to mental health. In 2021, she began her journey in becoming a certified life coach, NLP, MER, and hypnosis practitioner in Dubai. She now helps stressed high achievers wake up with mental clarity, calm, and confidence to seize the day and lead a fulfilled and healthy life. Witnessing a lack of awareness on the subject in dental career, she continues to bring value to our society, talking about the importance of oral health and its impact on our general well-being as a whole. Welcome, Dr. Vanessa.
Thank you, Aloisa, for this beautiful introduction. And I want to thank also Cardella and IWES for inviting me to bring awareness about oral health. And thank you all for coming here and joining us tonight. I know it's a beautiful month for a lot of celebrations for Ramadan and Easter. So thank you so much for dedicating your time to learn a bit about oral health and its importance for our general health. So welcome everyone. I have a presentation of what we will learn today. So I'm going to share my screen, how I can go with you on my slide. Perfect. Okay, I got it. So what we will learn today is the importance of oral health, the tooth anatomy, what are dental cavities and how are they formed in the mouth, foods to eat and foods to avoid to heal cavities naturally, how are cavities treated and prevented, and I will finish off by some takeaway points. So to make it interesting, I shared some photos and some diagrams to make it more interesting because I know dentistry is a bit of a complex structure subject for people to like. So first of all, I wanted to explain why is oral health important. So oral health is connected to one's general health and it influences other aspects of our overall health. Studies have shown, okay, that oral health is linked to systemic diseases like cardiovascular and diabetes. So you can't be healthy without a healthy mouth. And other than that, the mouth is the pathway to the body. So the teeth and saliva begin the first step of digestion in getting those vital nutrients that we eat from our foods daily. And other than that, teeth also helps us to speak and to smile. So it's directly impacting our physical and mental well-being. Now, what are teeth made of? We all have teeth, so it's important to understand what is the tooth anatomy. So in the diagram that I've shown here, this is a mandibular molar. A mandibular molar means the teeth that we have in our jaw in the back. But all teeth have the same components, the enamel, dentin, and pulp, but they would have, some of them have one root or multiple roots, but the components is pretty the same. So what is the enamel? So this is the crown of the tooth. This is what you see in your mouth. And the enamel is what you can touch. okay? So the enamel is the protective outer layer of the tooth, covering the dentin. And the enamel, funny fact, is the hardest substance found in the body. The enamel is composed of calcium phosphate mineral, and it is arranged in a crystal structure known as the hydroxyapatite. Then we have the dentin right here in the lower part. So the dentin is the second layer of the tooth. It contains microscopic tubules. I have mentioned it here. And these tubules are small canals that connects it to the heart of the tooth here, the pulp. So when the dentin, this part, loses the protective layer, the enamel, what will happen is that these tubules will be open and it will allow heat and cold or acidic and sticky food to stimulate the nerve and cells inside the tooth. That's how we have pain and sensitivity. And below the dentin, this is the pulp. This contains the blood supply and the nerve. And we call it the heart of the tooth because this is what makes the tooth vital. Okay? Now, what are dental cavities? So I've shared some photos. I didn't share so many disgusting photos, some interesting ones to understand a bit what are dental cavities. So the dental cavity is the result of a process that leaves a hole or a cavity in the mouth. So this here is the same like the one I showed you here earlier. Okay, it's the same structure. So here we have the enamel. This is a natural tooth. This is the dentin, and this is the heart of the tooth. And this is the cavity. It looks really small. In the mouth, you don't see it, but in the tooth, it's really big. And then it reaches the pulp, and then here we have the pain. And here we have a baby tooth. It's a baby molar. So the cavity is much bigger because the enamel in baby teeth is much thinner. So once it goes in, it goes really fast. So how does these cavities are formed? So I need you to understand that in the mouth, we have so many bacteria, but they're good. Some of them are beneficial. Some of them could be harmful, okay? So the ones that would cause cavities are called the Streptococcus mutans. Usually they're present in the mouth and they cause no problems. But when we eat sugary sweets, what will happen is that these Streptococcus mutans will digest them and they will release acid. They will produce acid. And then these acid attacks will affect the enamel. And then the enamel will get demineralized. And then if we have these frequent acid attacks on the enamel, at some point, the enamel is gonna crack and it's gonna create this hole. So these acid attacks are sometimes very fast. For example, like if we eat candy or refined sugars, these bacteria loves it. So they digest it in 20 minutes. So they digest these sugars and then they release the acid on the tooth. So it's very important what we need to eat. So if we choose more complex carbohydrates like found in vegetables and fruits, they are a better choice of texture because it's going to stimulate the saliva. And sometimes the cellulose is difficult for them to digest, so it will take a longer time. Cavities, important to understand as well, can happen on any surface of the tooth. It's not always we have to see it in our mouths. That's why sometimes the dentists do radiographs, sometimes small radiographs to see exactly where it is. Sometimes it's underneath the tooth. If you have food stuck between the teeth, we could have also a hole there. So it's very important to always get it checked with the dentist, even if we don't see it. But the good news is, before that, I wanted to show you the stages. So this is the enamel decay. So this is the cavity on the enamel layer. Here we don't feel pain yet because the enamel does not connect with the roots. Then here's the dentin. So here, the entrance is really small, but once it's in, the dentin is more soft. So it's like a sponge. It will spread much faster. And here is when it reaches the pulp and it will cause an abscess. So I would hope that it would not reach this point. Now, what is the good news? The good news is that the tooth is able to remineralize these dissolved areas if given the opportunity to do so. So it will do some remineralization. What is remineralization? It is a process of restoring minerals to demineralized areas, like teeth, bones, or any parts of the body that require certain minerals for their structure. So how can this remineralization process happen? First of all, is that we need to sometimes mechanically remove the plaque. You know, when you eat and then you have this type of texture on your teeth, even if you like rub, you have this white part. So this is the plaque. Like we have bacteria on the teeth and sometimes some form above it to protect the bacteria so it could eat happily the teeth. This is not good. That's why brushing and flossing is very important to be able to remove this plaque from the tooth to be able for the tooth to breathe. And that second of all, what we need to understand is that the saliva is very important in our mouths. So even if you eat very good, if you have a dry mouth, it's also prone to cavities. So the saliva, we always have to drink water and stimulate the saliva so that it will have all its beautiful nutrients to remineralize the teeth very well. Because once we eat these sugary sweets or anything that causes cavities, if we have a good saliva, it will temper the pH, because once these bacteria releases acid, the pH of the mouth becomes acid, and the saliva is more neutral. So it will balance a bit the pH in the mouth. That's very important. And another fact about saliva, it stops production when we sleep. That's why it's crucial to brush our teeth and to floss before sleeping. Very, very important, because when we sleep, when we wake up, we have a dry mouth because the saliva is like either it stops producing or really, really low. So it's very important to brush our teeth and to floss before sleeping. Now, one last thing, I'm sure you guys heard about fluoride. Fluoride is very important to have in our toothpaste, not in the water and these supplements, just topical fluoride. What we have in the toothpaste is really good. Okay, so what does this fluoride do? This fluoride would give the tooth this strength, especially for the enamel, to protect it from this demineralization process happening from these acid attacks. Okay, now, what are the foods to eat and the foods to avoid? So I think by now you would probably agree that there are foods that causes cavities, but you may not have realized that there are other foods can actually prevent or even heal cavities. So the food you eat on a daily basis have a direct impact on your oral microbiome and saliva. Oral microbiome is the microbes that we have in our mouth that work well. So when you eat the wrong food, this will create an ideal environment for the bacteria that causes the tooth decay, the Streptococcus mutans that I mentioned earlier. But most importantly, the quality of your diet determines whether you are getting the necessary nutrients to support the teeth natural remineralization process. So let's get into it. So the foods to eat, we have calcium, phosphorus, magnesium, vitamin D, and vitamin K2. So why is calcium important? Before, as I mentioned, in the enamel is made from calcium phosphate. So it is important to have these minerals in our foods because the structure of the tooth is made from calcium phosphate. So the calcium, as you guys know, has long been known to benefit dental health. In addition, it provides rebuilding blocks that teeth need on a regular basis. And calcium also helps to produce saliva and putting minerals back onto your teeth that you may have lost from eating. So many people would assume that products like milk and cheese are the best sources of calcium, but that's not necessarily the case. There are many people who have allergy or intolerance. So in that fact, you need to eat more like salmon, oysters, shrimps, clams, greens, nuts, figs, olives, and cauliflower. And for those who are not lactose intolerant, you need to take these dietary products from sources where the animals are not treated by hormones or antibiotics, because if they are treated with hormones and antibiotics, they negate any potential mineral benefits, so they should be avoided. Now, phosphorus here. For phosphorus, you need to have an adequate level of phosphorus. It's typically above 3.5. So it also helps to protect against tooth decay. But finding sources for phosphorus is a bit tricky. So phosphorus is mostly present in beans, grains, and also foods that contain phytic acid. So this is problematic because phytic acid is known to bind to the nutrients in food, making it difficult for our body to actually use them. But the good news is that there are other sources to find phosphorus, like meats, eggs, and some dairy products that doesn't have phytic acid. Now, for magnesium, why is magnesium important? Magnesium is important because it controls the balance of other nutrients in the body, including phosphorus and calcium. If left unchecked, it can promote demineralization of the tooth. So demineralization is that when the tooth is losing structure and cavity can form. So where can we find it? We can find it in cacao, avocado, leafy greens, squash seeds, and some blackstrap mollusks. Now, vitamin D. Vitamin D is known to be the sunshine vitamin. It is produced by the skin during exposure to the sun. Now, the vitamin D actually functions more like a hormone than a traditional vitamin. It controls the body's ability to absorb calcium and phosphorus. So even if you are supplementing with those minerals in an attempt to improve dental health, your efforts are largely wasted if you're not also monitoring your levels of vitamin D. Now, where can we find vitamin D? Of course, exposure to the sun. Then we have mushrooms, egg yolks, sardines, salmon, and spending time in the sun, like I mentioned. Now, for vitamin K2, lastly, vitamin K2, like vitamin D, it regulates the absorption of minerals in the body. Now, in fact, these two fat-soluble vitamins work together to ensure that the teeth have the calcium, phosphorus, and magnesium needed for remineralization. Now, where can we find K2? It's in cod liver oil, egg yolks, and chicken liver and grass-fed beef. Now, what are the foods to avoid? For the foods to avoid, we have foods high in phytic acid, simple starches, sugary foods and drinks, dried fruit, and acidic food and drinks. Now, phytic acid. Why is phytic acid not very good? So phytic acid is known as the anti-nutrient. It inhibits the absorption of certain nutrients, including minerals that are needed for remineralization, like calcium and magnesium. And it's typically found in grains, legumes, and nuts, including wheat, beans, rice, almonds, soybeans, corn, and lentils. Now, for simple starches, it turns immediately to sugar when you consume. So when you're having a handful of crackers and you feel this fizzy feeling in your mouth, this is the bacteria going nuts. They're having a party. They're having so much fun. They have so many foods to eat, and they're digesting it and producing this acid. Okay, so it is important to avoid pasta, white bread, white rice, goldfish crackers, and all of that. So sugary foods and drinks. This is pretty known that cookies, cake, chocolates, and fruit juices and candy is not very well because they are sugar that the bacteria digests and produces acid. This is known by now. And dry fruits are not so good. Why? Because when grapes are converted to raisins, for example, in this case for raisins, all the water present in the fruit must be removed. So the process concentrates on the naturally occurring sugars, which explains why raisins taste so much sweeter than grapes. So it's like a caramel in our mouth, so it sticks to the teeth. Then we have the acidic foods and drinks. So the acidic food in the following foods here wears away the enamel of the teeth. So it actually removes like a layer of enamel. It's so acidic that the demineralization process happens on the enamel, not like specifically a hole, but the enamel gets to be more fragile in this case. So soda and coffee, because the pH of the mouth becomes acid and that demineralizes the tooth, the quality of the enamel weakens. Then we have orange, lemon, and grapefruit juices. So these orange, lemon, and grapefruit juices could be highly damaging to the teeth. In one study, it has showed that it decreases the enamel hardness by 84%. It's pretty high. And acid found in citrus breaks down the enamel and it causes irreversible damage. You have to understand that the enamel, when a layer is removed, it does not come back. It does not heal itself when there is a really good chunk of it gone. So it's very important to always know what to eat and to remineralize it regularly. Then we have the sports drink. So the sports drink, not only that they are full of sugar, but one study has shown that it is more acidic than soda, like than cola and Pepsi and all of that. Then we have energy drinks and alcohol and kombucha. So kombucha is considered a healthy drink, but the issue with it is that the pH is between 3.5 and 2.8. That's very highly acidic. That's very good. Now, I'm sure you're seeing all of this and you're saying, okay, what can I eat now? I know it's impossible to avoid every single one of these foods, but we could have a healthy, balanced diet. For example, once we're eating, it's very important to always drink water afterwards because that's gonna balance the pH in the mouth. So it's about to balance the pH in the mouth. So it's very, very important. And eating, for example, a bit of cheese at the end to balance also the pH, that's very good. So the pH would be balanced. And then brushing your teeth, that's very good. But very important for brushing your teeth, don't brush your teeth after drinking cola. That's not good. When you're drinking these acidic foods and drinks, don't brush your teeth immediately. Why? Because once you're drinking these acids, it will become so harmful for the tooth. The tooth is demineralizing. So if you brush it, you're mechanically aggravating the scenario. So in this situation, when you're drinking these acidic drinks, just drink water. Drink water just to let the pH normalize a bit. That would help a lot. Or sometimes I recommend to some patients to drink with a straw. Because when you drink with the straw, it goes directly in the, you just swallow it. The pH is always acidic, but it's different than when you have contact with all the teeth. So drinking with a straw and drinking water afterwards, or like milk or ayran or something like that would help. And if you're eating like pasta, white bread and all of that, brushing your teeth after lunch or dinner is very important so that the bacteria don't have enough time for them to digest, or even if they started, it wouldn't be so bad, okay? And one last thing about the sugars, we cannot avoid sugars, we all need sugar. I would recommend to eat more sugars that are like ice cream, like soluble, because if we eat candy, it will stick to the teeth. You know, the molars, they have like little mountains and they get stuck inside of them. And once they are stuck, even if you brush, even if you go to the dentist, we cannot remove them. Like they're really microscopically inside. Unless we scale so much the tooth, then it will come out. But like caramels, candy, all of that sticky stuff to avoid. You could have some like chocolate or ice cream is good, milkshake, that's okay. But everything that is sticky to avoid. So these are little tips if we're eating sugars, drinking acid and eating pasta and normal to brush our teeth, and specifically to clean between our teeth. Because once the food is stuck between the tooth, even if you brush, if you don't remove it mechanically, it will stay there. And then little by little, the decay will happen. Now, how are cavities prevented? So, as mentioned earlier, you have to adopt the best diet for remineralization, focusing on eating the right foods, oral hygiene, like I mentioned, and other than that, to go to the dentist regularly. If you go to the dentist every 6 months to 1 year, I'm sure your dentist would tell you if you need to come every 6 months to do a cleaning. It is best because when the dentist, for example, this is a case here. So here we have a cavity, here, but these are very, very superficial cavities on the enamel part. So the dentist here would not touch this. Because if you would eat the right foods and you brush your teeth regularly, this cavity here will not go deeper than that. It will stay at this level. So up, it's okay, Elena, if you have to go. Thank you so much for being here. Now, so here we have these very, very superficial cavities, like I mentioned. So if you brush your teeth regularly, you eat the right food, this will not go deeper. It will just stay at this level. But then if you see here in this person, they didn't clean these areas. So I'm sure if they don't do this, 6 months later, they're gonna have a huge cavity between the teeth. So it's very important to clean our teeth. Okay. Now, how are cavities treated? So as I mentioned earlier, if they were at this level, the dentist would recommend that you brush your teeth regularly, you keep doing the right protocol, like I mentioned earlier, but it's the dentist needs to check, because sometimes the entrance would be small, but inside it would be big. So this is always the dentist that needs to check that, because if you see it with yourself, even me as a dentist now, if I look in the mirror, it's not enough for me to know. Sometimes if they put their probe and it's a bit stuck, maybe the entrance is so small and then it needs to open. Now, so always clean and brush, very important. Eat the right food, guys, and always go to your dentist, because if the cavity has entered the enamel just a little bit, they are gonna clean it. But when they clean it, they don't need any anesthesia. No anesthesia needed if it's in the enamel part. Not this level, a bit deeper, okay? But then if it reaches the dentin, here like I showed you, the tooth does not heal itself. It doesn't. So you need to go to the dentist, because once it breaks a really good chunk of the enamel and it goes in the dentin, it's gonna get worse. Even if you take natural stuff, it's not gonna help. It's only gonna calm your pain, but it's not gonna treat the tooth. It could only be treated and prevented if it's in the enamel, really, really superficial. But once it goes in, like here, a dentist needs to check it, needs to treat it. I really emphasize on that. So here, for example, they will clean. If you see the cleaning, it gets big because they have to really remove everything. Because if you don't remove everything, it will continue eating the tooth. So the dentist has to remove everything correctly. And then they were gonna put like a base material to protect the tooth, to protect the pulp, and then the composite. Like if you guys ever had a filling, it looks like the tooth, so it's not very visible. But it is important to treat this. And it does not cause a lot of pain. Like if you come at this level, it's just a small anesthesia. They will do it in 30 minutes, maximum 1 hour if you have multiple ones, and it's done. And you forget about it. But then if it gets to an abscess, this is the cavity. It started here, goes to the dentin, and this is the pulp. At this level, the tooth, it's very, very painful. It's one of the biggest pains in our lives that we could feel, really. It's very, very painful, because what happens is that the pulp starts to get inflamed and we feel like the tooth is going to explode because it has no place to express this type of inflammation. So it will start to go down and it creates an abscess. So what is the dentist going to do? They're going to do a root canal, because this pulp is infectious. It's dirty, it died. So we need to clean all of this with special instruments, and then we're going to fill them, and then we're going to fill it with another filling. Here, we may need a crown or an inlay. If you hear those terms at the dentist, it's because so much structure has been missing that they need to replace with a much stronger, solid structure, solid material. That's why I always recommend to go when it is super small and cute like this, because either it could be prevented if you do the right protocol, or he could do the treatment, takes 10 minutes, so easy. Or even if it's here, it's just one session, it will be enough, because here it's much more complex and this could be avoided. All right, just I have something in the chat, okay. All right, so now what are the takeaway points? As I said, we cannot be healthy if we don't have a healthy mouth. It's important. We can have the best diet, we have the best dietitian, everything. If your teeth are not well and you cannot masticate properly, to eat, to digest properly, it's all going to waste. So it's very important to take care of our oral health. And for the cavities, as a summary, we could see that it is caused by several factors. First of all is the teeth, the quality of the enamel. The enamel has to be strong, has to be thick to protect our teeth. Then we have the saliva. As we said, it is the protective medium for the tooth. Because if the teeth and the saliva are not working well, this is the stage for the bacteria to feast. Then we have the oral microbiome, the microbes in our mouths. There's millions and millions of them. So one note, please do not use a mouthwash if it's alcohol. Alcohol mouthwash is not good. It will kill the bacteria, but it's not good. Because if you kill the bacteria, then some bacteria are gonna be more stronger and it's gonna create some problems. Either don't use a mouthwash, but clean the tongue. The tongue is very important to be cleaned. And or use a mouthwash that is alcohol-free if you really need the mouthwash. But if you brush, you floss, or you use these special instruments to clean between the teeth and you clean your tongue, it's fine. No need for a mouthwash, honestly. And then we have the right diets. As I told you before, the foods to eat and foods to avoid. And lastly is the frequency of all these three factors. What does that mean? The frequency, for example, when you're eating a good meal, I would recommend, if you want to eat sweets, eat it right after, because it's the snacking that causes the problem. Because if you snack every half an hour, your pH of your mouth is always acid. If you're eating like a cracker here, you're drinking cola here, you're drinking your juice here, every half an hour, the tooth is continuously being acidic all the time. So I would recommend to have a good meal, drink everything that you need to drink. After that, drink some water, neutralize the mouth. If you had acidic beverages, don't brush your teeth right away. And if you didn't, you can brush your teeth, no problems, okay? So it is pretty important. So this is it. Hope you guys liked it. So I would be taking questions if you guys have any. So let me know.
Wow, thank you so much, Vanessa. I think all of us learned something in that session. Just to highlight the importance of a healthy mouth means a healthy body. And you did mention the cardiovascular and diabetes risk if your mouth is unhealthy, but also if you are not focusing on remineralizing your teeth, then it means you'll have poor bone growth and mineralization. So exactly. If your teeth are poor, your bones are also poor.
Yeah.
Okay, and then I'm sad Elena left because I know she's Italian, and I guess Italian food is mostly pasta, right, and breads. So I was going to ask her what she eats, but I think she mentioned she was going to have meat and salad tonight for dinner. So that's good. I think there was one question in the chat from Farzana who asked about aloe vera.
Interesting. For me, aloe vera, I mean, I have to do some more research about it because we're always focusing on calcium and phosphorus and magnesium. But if it does have any of those essential minerals in it, or if it helps to absorb these minerals better, then yeah, go for it. But I mean, for now, it's important that the aloe vera, that I think it needs to be natural and not acidic. Because look, orange juice is very good for our health, right? It's vitamin C, it's super healthy, but it is acidic. So the enamel will become much more thinner and will demineralize, although it's a very good juice, right? If, even like, for example, my mother used to eat like lemon and they used to rub their teeth with it. Like, this is not, no. The lemon is a healthy, you know, fruit or vegetable, I don't know what the lemon is. But if you eat it like this, the acid it's like using an iron on your teeth. You're losing layer by layer and it's irreversible. And then every time you drink something cold, it's so sensitive because the enamel is super thin. So you just have to check if it's acidic for the drinks, because there's so many drinks of aloe vera, I know, no sugar. And if it helps mineralization, I guess. But it is interesting. I would like to check that out, actually. Aloe vera. Thank you for bringing that up. We'll check more about it.
Her follow-up comment is that aloe vera is alkaline pH.
Awesome. So that's really good. So yes, for aloe vera, if it is alkaline, that is good. It's just acidic. It should not be acidic. It's not good.
Okay. Are there any questions? Any other questions? We still have a little bit of time.
Yeah. About how to eat so the straw is a really good tactic. And one other thing I would share about coffee and tea, something it's not about cavities, but I'm just gonna share some information. Coffee and tea stain the teeth a lot. So it's important to go regularly to the dentist to get a good clean, and then they would whiten, because I know some people will drink and use bicarbonate and don't use bicarbonate. Home bicarbonate is not good. Always at the dentist. I really emphasize the dentist, not because I'm a dentist, it's because people use harmful tools at home or natural remedies And I've seen like one person came with girofle, I don't know what's called in English. You know, there's something that is antiseptic, they call it for the tooth that you chew on. Sometimes it comes in an essential oil. And I had a woman come in, she put like a good cotton here on the gingiva because she had a huge pain. The gingiva left. There was no gingiva. I had to remove the tooth. So always check the dentist. If you have any doubt, it's better to be safe than sorry. The dentist will check, he'll tell you nothing to worry about, just maybe the gingiva just inflamed because something got stuck, or better safe than sorry. And it will cost you much less if you go to the dentist at early stages than going when it's really aggravated.
I've noticed a lot of people recently have been suffering with gum recession. Like
Yes.
the gum line recedes and it looks like their teeth are like hanging on by a thread.
Yeah.
So maybe you can give us some tips about that or some advice about that.
So this is more about prevention. I could do like a whole session for that, but if we're here, I could talk about it. So gingival recession, most of the cases that I saw is because of how they brush their teeth. When you brush, some, especially men, I don't know why, their teeth are their enemy. So they come home at night and they want to revenge after a whole busy day. They're like, I want to control something. And then they brush so hard and then the tooth becomes like, the brush becomes like this. This is no. So always, if you brush regularly, use a soft bristled brush, not medium, not hard, soft, circular motion, and clean regularly. So brushing would definitely, like aggressive brushing, because the gingiva is so sweet and so soft, it will go up. And once it goes up, it doesn't go down unless they do a gingival graft. They remove a part from here and they put it here. It's a whole surgery and it's very meticulous, and try to avoid it. It's much better. So brushing, this is number one. Number two is also acid, drinking a lot of acid. It will go up. So when the cavity, it goes in the cavity, because when people drink cola, I've noticed it goes everywhere, the cola in the mouth. So it goes up here so that the cavity is so deep, we have to cut the gingiva to clean it. So also the foods, and if they don't brush, sometimes people brush like this, they don't brush vertically. So if you brush like this, you're not cleaning the upper part that will create a cavity, and the gingiva will be so inflamed, but after we clean it, it recedes. And other factor is also health, like diabetes. I have very soft gingiva. It's also genetic. Some people have tendency to have very thin gingiva and have periodontitis. And so recession gingiva, other than the normal brushing, it could be also another disease. It's called periodontitis. It's gum diseases. It's a whole other subject. And it could be caused from, if you're not cleaning your teeth regularly, so the plaque builds up, you know, it builds on the tooth, and then when the dentist cleans it, he cleans it, and then the gingiva all the way down, because the plaque took its space. It pushed down. So it could be that as well.
Okay.
Up using the, oh, it's Cardella. Thank you, Cardella. So yeah, so could be genetic, the very aggressive brushing, not brushing correctly, so the cavities go in the here. And sometimes we have erosions from acid. So acid, when we drink so much acid in patients, we don't see a hole like the cavities that I showed you guys. It looks like a concave because it's like ironing, like I said, irons, and then we have like a groove in the teeth. That is from erosion, like and
like enamel erosion.
Enamel erosion, yes.
So you said that's caused by brushing?
And no, this is abfraction. This could, yeah, brushing, but mostly from acid, like acid.
Okay.
A lot of acid, like cola and all of that, the juices that I mentioned, it will demineralize the enamel, not causing it like a hole specifically, but we see a concave part and we see the dentin under it. So it's really, really acid juices.
So does that happen on the top, like the crown of the tooth, or on the side of the tooth? Because I've seen some people with like these ridges in their teeth, and those parts are like really sensitive to them. Is that the same thing?
So if it is ridges, some people, for example, they do this, they grind their teeth. So people who grind, also, it's not like recession, but what happens that when we grind our teeth, the enamel next to the gingiva is the thinnest, so thin. So when we do this, it will break next to the gingiva.
Okay.
Cracks, and we have these, it's super perpendicular sometimes. And I see it a lot, like the teeth are all flat. And then, because the enamel, like you saw, I'm going to show you again. It's a nice question. Let me show you a real photo of it. So here, I think with the cavity, yeah, here, you see this?
Yeah.
This is the enamel, and here is the enamel. Look how thin here it is. Here it's really thick, here is really thin. So, and this, by the way, is a cavity too, starting, demineralized area. So when here there is a lot of pressure, here it breaks. Oh, sorry. Here it crack. That would be not so good as well.
Okay.
And the lines that you mentioned, so it may be like an Arab thing, you know, the bizr, like the people, they love the bzurat. Yeah, so doing this a lot and putting things between your teeth, who knows, it could create those lines. But if they do a lot of this, also the teeth cracks. So when they smoke or drink coffee, you see lines between their teeth. And it's not because, like, it's because there is these fissures, like it's fractured in the tooth, so the particles go in.
Okay.
We see that a lot. Yeah.
Any other questions, guys?
Any other question, guys?